part of the team that treats breast cancer at the Uganda Cancer Institute. There was a question about breast cancer among men. Yes, breast cancer affects men and women. Of course, it affects women more than men, but men are also affected. For every 20 to 25 breast cancer patients, one of them is a man. So every time we have, maybe if we say 100 breast cancer patients, then it means we may get 4 or 5 patients who are male having breast cancer. And the challenge that we've had in men is because men think breasts are female organs. They do not know that they can also get breast cancer. So the message is men also have breasts. Men can also get breast cancer. Men should also screen for breast cancer, and men should also examine themselves, or they should also examine their breasts for any lumps, for any changes, and if they see any of those lumps or changes, they should visit a nearby health facility or the Uganda Cancer Institute for further care. There was also another question about breastfeeding for a shorter time. We know that breastfeeding is one of the preventive features of breast cancer. The longer you breastfeed, the lower the likelihood of breast cancer, and usually the benefit was recorded when you breastfeed for at least a year. Whenever you breastfeed, the cells in your breast mature, and when they mature and fully develop, chances of cancer forming in those cells are lower. That is how breastfeeding helps to reduce breast cancer. Now, those changes do not come if you're not breastfeeding a child, if you're not nursing a child, if it's your husband sucking your breast or something of that kind. Those changes do not occur. So a man sucking your breast may not necessarily save you from breast cancer, but a child, by you breastfeeding your child for at least a year, will reduce your chances of breast cancer. How can your husband help you? One, he should encourage you to examine your breasts every month. Know your breasts so that in case there is any change, you're able to detect it early. He should escort you to the hospital, and in the event that you're diagnosed with breast cancer, he should support you throughout the treatment, because we know that when we detect breast cancer early, the chances of cure are above 90%. Then there was a last question on myths. There are some myths on breast cancer. Breast cancer is not a curse. Breast cancer is not a punishment. It is a disease like any other disease, and it can be treated and cured. So in this October Breast Cancer Month, I would like to encourage everyone to move the conversation of breast cancer. Let's talk about breast cancer in the markets, in the mosques, in the churches, and let's support all our women to catch breast cancer early, because we know that when we catch it early, the chances of cure are above 90%. Thank you very much.